Thank you, Chairman. Doctor, thanks for coming on out. You had said before that you were in favor of decentralizing in the decision-making at NIH. I think a quote, restructure the NIH to allow there to be many more centers of power, concern about individuals or small number of individuals from dominating decision-making. Do you still stand by that? And if so, what's the importance of decentralization from your...
Senator, I think I do stand by that, Senator. The key thing to me about decentralization is a diversity of ideas to address uncertainties, and when we have problems that we don't have the answer to, we have to allow there to be many people with different ideas to test them. Having a diversity of ideas, we talked already with some of the other senators about making sure scientists from smaller states get access to NIH support. That's one way to do it. Having younger scientists, or early career scientists.
But you're also saying just decentralization in terms of who's making the actual decision, not where the resources are going. Is that correct?
Well, I mean, if I'm confirmed as NIH director, the job will be to decide how to set processes to making those allocations. I want to make sure those processes allow early career investigators to have support. I want to make sure that it allows scientists from non-traditional universities, not just the Stanfords and Harvards, to have support. I want to make sure that the people with different points of view about scientific hypotheses, not just amyloid hypothesis, but other hypotheses, have some capacity for support.
So in terms of the decision-making process that we'll try to diversify that, I guess my question to you, if you're pushing for a decentralized decision-making process for the grants, does that mean that you would oppose the HHS secretary or the Trump White House from telling you to make decisions about where to spend money or funding grant decisions?
Senator, I agree with the goal to make America healthy, meaning address the chronic disease crisis. That's a decision about allocation to different disease areas. Mm-hmm. The scientific ideas inside those disease areas.
What if the HHS secretary said, I want you to fund this specific grant at this university?
There's a process, Senator, for deciding who gets grants, the specific grants, right? There's a scientific review panel.
But is that one of the processes? Is that something that you feel like is a valid way in which decisions can be made at the NIH?
Senator, I don't believe that either secretary or the president would ever ask me to do that.
Well, I guess the reason why I asked this is, you talked a lot about chronic diseases. I think all of us can agree we need to make chronic diseases. My question to you is, do you think that our work on researching chronic disease needs to come at the expense of research for infectious disease?
Senator, I think that the allocation of funds to the different disease areas, first, Congress has a tremendous important role in deciding that, and I'll work with Congress for sure to make that happen. But also,
but you think that we could probably do both, right? Both chronic disease research and infectious disease research.
Yes, Senator.
Okay. Well, the reason I mentioned this, and I asked these questions about the Secretary's ability to direct NIH, is that he had a quote that has just really stuck with me to alarm me. He said, quote, "I'm going to say to NIH scientists, God bless you all. Thank you for public service. We're going to give infectious disease a break for about 8 years." Now, does that sound like a good idea?
Senator, I've had many conversations with Secretary Kennedy, and he is supportive of excellent infectious disease research. The idea that
you believe he no longer stands by that quote?
Senator, I don't know where the provenance of that quote. Maybe it's on Twitter or something. But people say things on Twitter. But as far as
he said it at a conference.
Yeah, I don't know about it. But my interactions with Secretary Kennedy, he's sincerely committed to making sure that every health need of this country is met, including infectious diseases.
In terms of a few other things, are there any vaccines out there that you are concerned about in terms of safety?
Senator, I was concerned about the COVID vaccines for young men with causing myocarditis in 2021.
And do you have a view on long COVID?
Senator, I think it's a problem that affects millions of Americans that we need answers.
Is this something worth NIH funding?
Yes.
You had a quote before that I was concerned about. You said, quote, "There are more pressing health needs for the $1.1 billion that the NIH will spend on long COVID." Is that something you still stand by, that quote?
Senator, I think that the funds that have been spent to date on long COVID have not provided answers to the millions of patients. I think that they deserve answers. We need to do a better job with the funds we spend at the NIH so that it actually produces better diagnostics, better cures, better prevention.
On transparency, just real quick, you talked about the importance of transparency. Are you familiar with something called the Richardson waiver?
No, Senator.
Okay, well, I ask if you're confirmed that you look into this. The Secretary just reversed this, and it is something that closes some transparency and public comment periods. Thank you.
Thank you, Senator Kim. Senator Banks.
Thank you, Mr. Chairman. Doctor, congratulations again on your